Yes, indeed, right there. Let's read along. The state of Oregon is asking its citizens to pay for obese people to get weight loss surgery. The state claims that cutting the fat now will save them health care costs in the future. But should this be the taxpayers' responsibility? Here for a fair and balanced debate from Detroit, plastic surgeon Dr. Anthony Youn, and in Dallas, bariatric surgeon Dr. Robert Sewell. Good morning to both of you.
Good morning.
Thank you.
Dr. Youn, you think this is a good idea, the theory that if a person is obese, you spend the money now, you will ultimately spend less money down the road.
Exactly, and it's purely an economical reasoning behind this. I mean, obese people spend approximately $2,200 more a year in healthcare-related dollars versus non-obese people. And studies are showing that after bariatric surgery, which costs anywhere from $10,000 to $25,000, these costs are recouped within about 5 years, and sometimes even less. Well, and you take into account also that we're making people healthier.
Okay, well, it sounds great, and it looks great on paper, but Dr. Sewell, you do this particular kind of surgery for a living. If a person has the surgery, does that then change their life?
Well, it can. Certainly, people have varying results following these procedures, and it's my opinion that the patient has to take personal responsibility to some degree. Now, he's correct in that certainly the savings can be dramatic, but the savings are really to the patient in the way of less food costs and less medication costs down the road.
Dr. Sewell, tell us about the lady you told me about during the commercial, about what she said before she had the surgery to you.
Well, she's just one example, and the patient who basically told me, she said, I just want to have this surgery to make me skinny, but I want to be able to eat anything and everything that I've always eaten because that's my lifestyle.
Right, exactly.
And clearly that's a major issue, and the state of Oregon or any other government agency has no way of assuring the commitment of the individual patient when it comes to how they're going to change their behavior.
Sure, and Dr. Youn, you'd have to admit there probably are people like that. They figure, okay, I'm going to get that surgery, I'm going to be skinny, but I'm going to eat whatever I want to. You know, you really do have to address the lifestyle, and people have got to take responsibility. If I'm going to have this $25,000 surgery paid for by the state, maybe I better do my best to keep my weight under control.
And I agree with that, but then you also take into account that insurance companies are also paying for people to help quit smoking. And when you look at it purely economically, these types of programs do make sense. I mean, they save us money in the long haul. Isn't that what we want, you know, in addition to people being healthier?
Sure. Dr. Sewell, I'll give you the final word. What do you think? Do you think this is a good idea, what Oregon is doing?
Well, I think that anytime the government or any other third party gets involved with a patient-physician relationship, it begins to sour that circumstance, and every patient should have their right to choose. As soon as the government or any third party gets involved, that right to choose is going to be taken away.
All right, and we'd invite our viewers right now who are watching, what do you think about this particular procedure up in Oregon? Dr. Youn and Dr. Sewell, thank you very much. Great discussion this morning.
Thank you.
Thanks, Steve.
All right.